And perhaps both of you can chime into this question of community engagement, particularly when it comes to brand new settled groups of immigrants or refugees. What have you seen worked? What does not? What should we bear in mind?
I'll let Dr. Winer go.
Sure. It's a great question. We have another sort of visual tool that our group has worked on over the past year to try to conceptualize this. One thing that I think is helpful is to really think about what can a program do to connect out to help facilitate trust within. So you can think of it as sort of along two axes. So sometimes I make the joke, like if you build it, people won't necessarily come, because even if you have a well-intentioned program, that's only part of the conversation or part of the puzzle. And so it's really working collaboratively with communities in a non-transactional way to understand needs. So if I go in and say, hey, I'm the psychologist from Boston Children's, like, I want you to partner with me on this grant, or I want you to do this thing, it has this sort of patriarchal, colonizing kind of vibe that is often the last thing that people want to engage with. It often comes from a good place, but in this moment, we care a lot more about impact than intent. So to have a more effective impact for community engagement is trying to collaboratively, through genuine partnership, try to understand what are the needs, what are the challenges, what's going well, and then what things would folks want to be different, and then how can someone use their relative privilege or power to try to engage or move the lever on that. So that's one sort of big picture thing. So trying to reduce the transactional encounters and build relationships early, and then attend to them consistently. It's like watering your garden.
Well said. I don't really have a whole lot to add, but building relationships, and like you said, building them kind of early on, not when you just need something or what have you. Yeah, I don't think Denzel, I don't really think I have anything to add to that one.
Well, perhaps you can add to this one. Could you describe for us any significant differences in the kind of stressors or PTSD among differently categorized migrants? I'm sure we can identify commonalities in terms of what they've been through, but are there certain special considerations, for instance, with unaccompanied minors, for instance, with refugees from Myanmar, for instance, with refugees from different parts of Africa?
I may also turn over to Dr. Winer for that one. My expertise is, I am a social worker, but I tend to be a little bit more on the macro side of things. I'm not a clinician. And I tend to personally, I really appreciate Dr. Winer and his team, Dr. Heidi Ellis, their whole core stressors model, because I think that they aren't just looking at kind of a Western lens of PTSD and things like that. They're really looking at that acculturation stress. They're looking at that whole level with the resettlement stress, and we look at the stress that comes along with being undocumented or having immigration court dates. Like, that's not in the DSM, that kind of thing. But Dr. Winer, do you have any more thoughts on that?
Do you mind repeating the last part of the question? I was just trying to go through the chat to see if there were any things directly related to that.
Certain special considerations when it comes to different migrant populations, when it comes to their stressors or their PTSD. I'm saying that we can certainly identify certain commonalities among different groups, but are there certain special considerations with certain different populations?
Sure, and I think I wouldn't want to say, yeah, so the world is complicated, and by definition, who are forcibly displaced communities is an evolving experience, because I was born in the 80s in suburban East Coast United States. If I'd been born in the late 30s, early 40s in parts of Europe, my family would have been forcibly displaced because of aspects of our identities. And so really when folks are displaced, it's often a constellation of the socio-political or environmental phenomenon of that moment, and then how other sort of geopolitical forces respond. And so there are times where if folks are displaced because of a civil war or armed conflict, some of the challenges related to that and some of the common traumas are important to attend to. Whereas if folks are displaced because of problems related to climate change, some of the traumas or challenges may be different from that, or folks are displaced because of some other reason that they needed to seek humanitarian aid. One of the challenges in the UN definition of refugee is it's a relatively specific, and it's a definition from the early 50s. So there are folks who many of the tools and strategies we're trying to build, they may benefit from them, but they don't formally qualify for refugee status. But usually in our perspective, there's a lot of tools that can be helpful. And then the other piece of that is partnering with community and cultural experts to deliver services. And so there's some of that we can learn, so much content online to learn about why are people displaced and what are some of the common challenges, but really partnering with members of the community is incredibly important.
Well said. Completely, very much better said than I could ever say, but totally agree. Because I was like, the Central American communities come to mind, where it's very rare that they meet this, that they can get refugee status or asylum, but so many of their situations are very similar, including all of the, trauma backgrounds as a lot of the other populations. So I think it's a little too hard to make generalizations kind of in responding to that.
And the other piece is often based on people's background. So I have a PhD in clinical psychology. So in grad school, we talked a lot about trauma. If you think about the 4 core stressors model, that the upper left, the yellow. However, if you're trying to engage both in delivering the service or supervising services or building intervention models, you often need to think about all these other pieces first, and often in the actual service delivery, attend to those first, rather than going to some of the most sensitive, vulnerable experiences of people's lives. And so sometimes you have eager clinicians or educators who are like, we need to go right there. And it's like, don't go before you're ready, and you're not doing anyone a service pushing someone into a narrative. Doesn't mean that there won't be a time to do that, but really attending to all these other things. My colleague Hong Sung Park at Mass General Chelsea put this beautiful slide together in a presentation he did previously, where it basically mapped out common symptoms of acculturative stress and traumatic stress, and how if you, for example, were supporting a kid navigating common acculturative stressors, you may reduce many of the things that you thought were, PTSD or traumatic stress.
Mm-hmm. And this is why I like and appreciate your model so much, your whole teams. I refer to it constantly because, right, I think in education and in social work, we see a lot of that gravitating to the upper left-hand corner, like you said, of the core stressors toolkit. And all too often we forget about the resettlement stress and all the poverty pieces, the acculturation stress, the isolation. And so like in all of our trainings, I always highlight your model because I said, we got to focus on these 3 as well. It's not just honing in on the fact that, Carlos, maybe he saw his father murdered when he was 2, but he's also being bullied. He has an immigration court date coming up and doesn't have an attorney, has to pay rent, like on and on and on. And we see that divide also in social work, where a lot of social workers, unfortunately, there is this divide between sort of like clinical and macro, or, somebody comes to you and says they essentially need help. The thing that's stressing them out the most is some of those other areas. And a social worker will say, well, I'm clinical, I don't do that. And you're like, but that's where the trauma is right now. That's where the stress is. So sorry, Denzel, send us off on a tangent.
Elena asked a really good question about, many of the refugees she works with have well-founded fears regarding opening up themselves to the Western model of mental health care, having their children taken away, being forcibly hospitalized.
Yeah.
Given that this system is not grounded in their cultural beliefs, but in our own, how do you get refugees to come along with these justifiable fears to buy in?
Yeah, and I think that goes back, again, trying to take the trauma-informed lens of exactly as you said in your question, why does it make sense, as opposed to like, oh, why don't they care about their kid? I gave them a referral and they didn't go. And it's like, it's almost always, why does it make sense? And then how do we partner with that? So this is why in our model, it has such a heavy emphasis on cultural brokering and community partnerships. So that way you can engage trusted messengers from the community to talk about these ideas, rather than someone coming from outside a community who's not culturally and linguistically sophisticated. If you have a trusted messenger from the community who's saying, hey, I'm working with this folks, this is what it, being concrete, this is what it means, this is what it doesn't mean, and this is why it aligns with some of our both sources of pain and the values we want to, ascribe to. I think it's also important, to be really explicit. A common challenge is parents are adapting to a new culture. Certain parenting practices are that were allowed or not allowed in this context. And so trying to not get into the shame and blame game, but get into a collaborative learning environment, so that way people can learn there are new tool or other tools, and then it makes sense that they use those tools before because that's what they knew or had access to. And now how can we do this together? Again, and engage with cultural brokers and trusted messengers.
Denzel, could I actually ask Dr. Winer a follow-up question on that?
Sure.
Okay, just had to ask. Dr. Winer, I'm curious, could you say a little bit more about...
It's actually pronounced winner.
Winner, thank you. I'm so sorry. Dr.
No
Winner,
problem.
Could you say a little bit more about that, and how you gave kind of like a child welfare example with like parenting practices. Could you also say a little bit more about in communities where there are religious or spiritual beliefs tied in with mental health, and there are perhaps like traditional healing practices utilized or things like that, maybe how you integrate your, how your approach integrates with traditional healing and that type of thing. Does that make sense?
Sure, yeah, and I think that there's a lot of folks who've articulated these kind of ideas sort of more beautifully than I can. I think the simplest way I think of it is, how can we take a both and approach as opposed to a this or that? And there are times where it's really around trying to open up the conversation. One question I like is, how do people in your community or your family deal with challenging times? What do you do when things are hard? What do you do when things are sad? And trying to learn more about how people navigate that, and then getting to a place where we can say, are there pieces or aspects of that you'd like us to use in our work, or are there things that you would like us to try to help your loved one or family member? And so trying to view it with an open mind and heart, so that way those things can come forward and then you can engage with it. Then there's the next layer of, say there's a particular practice that someone's engaging with that you think may be harmful or is not culturally congruent based on some aspect of the culture that you're a part of. Then really working collaboratively around, okay, who is this for? How do I, as a provider or educator, seek supervision or support? Be like, okay, how do I navigate this? And then what's in the best interest of the child and the family? If people also, and for mental health providers, the DSM-5 has a whole cultural appendix where it talks about what's called cultural idioms of distress, in terms of culture-specific syndromes that folks might find interesting in terms of how things can present based on specific cultural backgrounds.
Thank you.
Thank you, Jeffrey. And just really quickly, before our next presentation, could you just provide some resources or outlets where teachers can learn more about trauma-informed practices, and also specifically, Kristen asked about supporting students with active asylum cases. I mean, Laura, you gave us some really brand new information that we didn't know about Honduras, for instance. So how do we better understand these populations and how we can help them?
There was a couple questions wrapped in there. Can you say that one more time?
Well,
more resources.
The main thing is, where can they turn for better resources to cater to these populations?
Yeah, so I'm happy to share the slides or a version of those slides that I sent, and there's a bunch of links and resources, both stuff from our group and then other groups. And has a lot of, I think, great content. So I'll share that.
Yeah, I often refer to your website. Exactly. I mean, Denzel, as far as kind of unaccompanied minors and sort of my piece, On our website, we have a number of things. I think you posted the blog article. There's another one that came out recently. I think I have it pulled up that I may be able to put in the, let me find that. Yes, KIND, the organization Kids in Need of Defense, came out recently with a great document called Unaccompanied Immigrant Children in U.S. Schools. Let me put that in the chat box. Okay, there, I just posted that. That's a great one. And I think when you just mentioned Honduras, you were referring to what I was talking about Guatemala. You're talking about when we were talking about the indigenous, yeah. I do want to share actually one more resource that just came out literally the other day. I think when we think about the indigenous Mayans, in general, they're kind of invisible, right? And then in schools, they're even more invisible. And so there was a very short documentary that just came out the other day. They highlighted it on NPR, and then I watched it. It's called Chu Boys of Summer. So CHUJ, that's one of the Mayan communities. I just posted it in the chat box. And that's a great clip. They show the student trying to register for school, and kind of just also the challenges of being an unaccompanied minor and trying to kind of make ends meet and having to kind of work and pay rent and like that whole juggle. It's literally only like 15 minutes, but that would be another current one that I think is really helpful for people to watch and kind of understand our students' stories.
Thank you so much, Laura. That's great. Hot off the press. I really like that.
Yeah.
Laura Gardner, Dr. Jeffrey Winer, thank you so much for joining us today and for imparting such incredible information. You really helped us to understand how to deal with our immigrant and refugee students a lot better. Thank you so much.
Thanks for having me.
Thanks, everyone.